Today I want to talk about transitioning from ICU to PACU. Hey guys, it's Noreen and thank you for making it to my channel. Today I want to talk about transitioning from ICU to PACU. So if you're a nurse looking to transition from ICU to PACU, hit subscribe because I talk about that here. So first things first, how I ended up going into PACU was, I was an ICU nurse. I've been a nurse for 10 years, primarily in the ICU. After the pandemic, I just did not want to do ICU no more. Very traumatizing, triggering. I just had enough. I was burnt out. And so my mom is actually a PACU nurse and life seems good over there. So that's how I decided, you know what, if I'm gonna have to do nursing, then I'm gonna go transition to PACU. And so basically I finished my last nursing contract. And so first what I started was I went through Medley. It is like a little agency. I went through Medley and I did outpatient PACU with them. And so basically with that, it's like super easy, quick. You have like EGDs, eye patients, like super quick. I wouldn't even do that anymore. I think it's a great way to get your foot through the door and get some experience and get acclimated. So I would recommend doing something like that if you want to go outpatient, but do understand that it is very fast paced, like fast. That's not my style. Like me, I want my heavy sedated patients that had like a whole colon, had a whole colon, I was gonna say cholecystectomy, but I was gonna say a whole colon surgery. They come out, they're chilling, not bothering me. Those are the kind of patients that I like, okay? But, so I would say if you wanna do that, do that. Try outpatient, get your foot wet first. If you can transfer within your facility, I would definitely recommend that you go to your PACU network. Try to see if you can shadow a shift, pick up a shift or whatever. I feel like transitioning within your facility is probably your best bet because you're already in the facility, right? And so it makes sense for nurses to go to PACU. So this is what I do, okay? I have friends that want to transition to PACU. They don't know what to do. So I tell them, you need to go there, network, okay? And then if you're ICU nurse, we get patients straight out of the OR all the time. We are constantly recovering patients. And those patients are worse than the patients that you're going to be dealing with in the PACU. Most of those patients are either going to go home that day, they're going to go to day surgery, or they're going to go to the floor like med-surg tele. So ICU prepares you way better than anything can possibly can. And honestly, I feel like any bedside nursing really, but ICU is for sure, like you're getting patients straight out of the OR. You know how to recover a patient. You know how to prioritize like your air management. You know what to check for. Make sure your patient's not desatting. Make sure there's no stridor. Make sure that there's no bleeding coming from the site. Things like that. So ICU nurses are really good. However, for PACU, but the thing is, it's hard to get into PACU because most of the times they want you to have PACU experience. So I would definitely say like network or something like that. Tailor your resume, okay? Yes, you have ICU experience, but you need to highlight that you can recover patients and things like that. Like you definitely want to highlight those PACU terms and PACU things that you've done in the ICU and put that on your resume and make sure that stands out. Let them know that you've done with intubated patients, sedated patients, waking up patients, things like that, recovery things. You definitely want to highlight that, okay? So definitely switching over to PACU. So I don't know where I left off, but I do want to say, just as a nurse in general, we're constantly monitoring our patients, monitoring their vital signs, respiratory status, neural status, all that stuff. We're also doing pain control, pain management. That is things, and then the airway management. That is things that is very important to have as a PACU nurse. So I will talk about the patient load. So typically in PACU, you will have 2 patients. Well, that's what it's supposed to be like. I've gone to places where sometimes you have to have a little bit more because it's just so busy, especially like when the patients are coming out of surgery back to back, so you get slammed with patients. But typically you will have no more than 2 patients at a time because the acuity is high, they're fresh out of surgery, anything can go wrong. So you're basically in a bay, you have your 2 patients, you're monitoring them, making sure they're good. And once they're stable, awake, depending on your facility, some places have phase 1 where they're coming to you straight out of the OR. And then when they're recovered, they'll go to phase 2. which is more so like a day surgery. So I've worked in facilities that do it both ways, where straight out of the OR, they're coming to us once they're like up talking good for a few minutes, for a little bit, whatever, swallowing, no issues, then they'll go to phase 2, and that's where they'll more than likely go to their floor, to the room on the floor, or they'll go home. But some places don't do it like that. Some places it's just one place. The patient's coming to you, you're recovering your patient, you're either sending them to the floor or to home, discharging them home. So I've gone to, so I've worked at one hospital where we were phase 1, then we sent them over to phase 2. Another hospital, I've done we took everything, and then another hospital, it was a phase 1, phase 2. And then I've also worked in day surgery too. So day surgery is kind of like the outpatient thing where you have the patients getting these quick surgeries, think cataracts, EGDs, colonoscopies, super quick. So yeah, there's different ways you can go about it. So that's definitely something you want to learn and be aware of. And so is this, how does that facility run, right? And so the other thing I'm talking about is the shifts. So the shifts varies. So some places you'll have 10, some places you do 4-10, some places you do 3-12, some places have different shifts where you can play around. Sometimes you could do 5-8. Most of the time on my contracts, so the outpatient ones are more likely like the 8-hour shifts, like 7 to 3, 7 to 2, 8 to 4 type of thing. In the hospitals, you'll have the longer hours. So some hospitals I've done 4-10s. Which I didn't mind. I mean, it was what it was. I didn't mind. Like I would start, I want to say like 8 to 7 or something like this. Some places, and then sometimes they do have the 3-12s. Like I've had coworkers that work 3-12s. So it just really depends on your facility. I'm trying to think. My last contract, it's been a while. So yeah, most of the time I did 4-10s, and that's what worked for me. But you can also get 3-12s. You can get you can like be flexible, but work with your schedule. The other thing that I wanted to say is that teamwork. Usually the teamwork when I worked in PACU has been really great. They have been very helpful. It's usually a rotation. Like you're getting this first patient, now second patient, third patient, boom, and then another round coming is like that. So it alternates. Like there's a rotation of who gets the next patient. Typically, most of the time, you don't get ICU patients. It depends. Sometimes if ICU is full, then you'll have the overflow, so you have to take an ICU patient. But more than likely, the ICUs will go straight to ICU. They're not coming to PACU. So your patients coming to PACU are like lower acuity, med-surg tele, or day surgery. So my advice would be to definitely try to transition from your facility into PACU, especially if you're burnt out. Like if you're burnt out, tired of bedside, definitely transition into PACU and then try to get you a job outside of whatever. But PACU is definitely your first step. Keep trying, don't stop. Tailor your resume. I gave you guys some tips earlier to definitely tailor your resume. I want to see maybe how I can do like a template of what worked for me. But yes, definitely tailor your resume. Make sure you have your ACLS, your PLS, all that stuff. Because everyone has BLS, but you want to have your PALS and your ACLS. And then they have a CPAN if you really want to go that far and do that. And I'm trying to think anything else. So what I would say was cool with PACU was like, I feel like it depends on the hospital. I felt like, it was a little bit slower than ICU. You had some downtime. Like if they're in the surgery, you're just waiting for them to come out. Sometimes they're in a long surgery, like those colon surgeries take a long time. So you will have a little bit of downtime. But what I didn't like is sometimes it's super fast. Like these patients are popping out. Like if they're having like a knee replacement or arthroplasty, those surgeries are quick. Like, and it's like and then they be in a lot of pain if they don't get a block. So stuff like that was like kind of annoying. And then you just have to like follow your anesthesia order, follow your anesthesia protocol, which I mean, I feel like in that regard, it's like pretty simple, pretty easy. You have all your emergency meds there. Where I worked at, I had great help. Sometimes I would say like, sometimes you do miss the ICU just cause like, you get to like fix your patient, and in PACU you're not really fixing your patient, you're just recovering your patient and sending them on their way, which is not a bad thing too. So I would definitely say that's like 2 things to consider. Like the pace is different, but you do have a lot of downtime more than likely in PACUs. So I definitely recommend that. I'm trying to see like what was the pros and cons. So the other thing I would say is a pros and cons is a con is just depending how the facility works. Like, because me working PRN, when it's slow, you're first to go home early, and so that was an issue why I wanted to get a full-time staff position. I wanted to get like locked in hours. I didn't like the whole going home early, like especially if you're picking up, like sometimes they might cancel you if there's not a lot of cases, so I don't like that. Versus ICU, you know, you're getting your full 12 hours, right? But then here in PACU, it's a little finicky. You kind of have to fight for your hours. So that's definitely something I would say I did not like, was like the hours are finicky. But that was just me as a PRN. As a full-time PACU nurse, it was probably going to be different. You probably will have locked in hours, but that's definitely something to consider, is that the timing can be a little iffy. I can't really think of anything else right now. If I do, I'll throw it in the video. But I definitely recommend you go to PACU if you are tired of bedside. Okay, it's definitely going to be a quicker switch. You, as a nurse, you already recover patients. You're monitoring airways. You're giving pain medicines. You know what to check for after surgery. You can definitely do it. You need to tailor your resume and use those PACU terms. Okay, and then I don't know what else what other advice you could do. Definitely network. That's what's gonna get you there. Network, okay? Network. Definitely try to start like outpatient and then go inpatient. Yeah, I think that's it. So I hope you guys found this video helpful. If you guys have any questions, let me know. I can answer them for you.